Recording on. Welcome to Talking Data Equity for Friday, May 31st. My name is Heather Kraus, and I'm the founder of an organization called We All Count. And one of the things that We All Count does in our kind of mission to build tools and techniques and bring people together around aligning the choices that we're making in our data projects with our equity goals is we host something called Talking Data Equity. And that is what you have arrived at today. Talking Data Equity happens most Fridays, not every single Friday, but it happens most Fridays. And the purpose of Talking Data Equity is to gather with anybody from any part of the world, from any sector or discipline who's interested in increasing the equity in their data projects and have an informal space where people can have conversations, share ideas, share experiences, and share resources. And we welcome you if this is your first time joining us. This is fantastic news. We're always happy to see new faces. And if you've been here before, welcome back. Talking Data Equity is always richer because of the kind of core group of people that keep coming back, which is so kind of amazing and cool. Something we didn't ever really plan for, but is a wonderful, happy accident. So the way that it's going to work today is that we do have a special guest. And we are going to hear from our special guest in just a minute. But first, I'm going to share a little bit of logistics. You can see that this is a Zoom meeting, which means that you have control over your video and your microphone. You can turn your microphone on and off and your video on and off as you wish. And what we ask is that because we're trying to have a Zoom meeting with a couple hundred people, we ask that you keep your microphone turned off while our guest speaker is sharing her slides and her stories. And then once she's done sharing her slides and stories, we're going to have a live Q&A time period at which you can raise your hand and we'll unmute the mics one by one so that you can ask questions or share experiences. However, we want you to feel really comfortable to use the Zoom chat throughout the entire hour. So while our guest is sharing her stories and her ideas and her experiences, you can feel free to have conversations in the Zoom chat, ask questions in the Zoom chat, and share your own resources using the Zoom chat. And you can do that either using the Zoom chat with the menu set to everyone, which means everybody here will be able to see your comment or see your question. Or if you feel like you want to ask a question privately or make a comment privately, you can put my name, which is Heather Kraus, in the drop down menu, and then it will come only to me, and I will do my best to kind of amplify your comment or your question, and I won't share your name. Okay. And this is being recorded. Most of these Talking Data Equity sessions are recorded. And the reason that they're recorded is there's lots and lots of people that are working on equity in their projects that can't come at this time. So we share the recordings in our We All Count Data Equity Forum. And I just put the link there. Okay. So enough of me talking. Let me introduce you to a special guest that I am extremely excited about. I've known this special guest for a while now, and so I'm familiar with her great work. Our special guest is Julie Plagenhoef, and Julie supports the Nurse Family Practitioner Partnership and Babies First, which are both super cool projects that I encourage you to check out. They are home nurse visiting programs for the maternal and child health section of the Oregon Health Authority. And I have to give a huge shout out to Oregon. I don't know exactly what's happening in Oregon, but the people that work with data in Oregon are amazingly cool people. So Julie believes that home visiting changes lives, and she's honored to be part of this work for over 6 years. Prior to joining the maternal, child, and health team, Julie worked at various times as a pediatric medical and adult trauma nurse, an epidemiologist, a biostatistician, and a Peace Corps volunteer. So you can see there's all kinds of good stuff happening. And Julie is here to share some of her experiences with us embedding equity in the projects that she's doing. So, thank you for taking time out of your busy schedule. Thank you for reaching out to us. I was very excited to hear that you'd be willing to do this. And I will turn it over to you, Julie.
Great. Thanks so much, Heather, and welcome everybody this morning. I'm really happy to be here. Um, I just am excited to share this work and get ideas from other folks as well about how we can make it even better and carry it forward. I think you'll see at the end, like that's kind of the hard part, the keep on carrying it forward. So I'll go ahead and share my slides and dive right in. Here we go. All right. Does that look good, Heather? You got to see my slides.
Yep,
Okay.
it's perfect.
So usually I give this presentation with a coworker in the local community, Multnomah County Health Department. Her name is Vashita Charles, and actually we did this presentation at a national conference, and and she was there with me, but she is on maternity leave and not able to be here. So I'm going to do my best to kind of honor what she would be saying as well in this presentation. And yeah, we'll take it from there. So yeah, as Heather said, I am the state nurse consultant, and so I support home visiting programs. And in particular, our Baby's First Home Visiting program is an Oregon homegrown program. And so we pretty much have control over uh, pretty much every part of the program, in particular, what data we collect. And back in August 2022, we were going to implement a new data collection system. And so we thought, well, this is a great opportunity to enhance our data collection. We had kind of had one in place for, it was supposed to be interim, and it ended up being like 10 years of being interim. So we thought that we really need to revamp what we're collecting. We want to improve our ability to support the quality of the program. What are quality assurance measures we can look at? Babies First is not an evidence-based practice. It's evidence-informed, but it hasn't, gone through all the evidence-based practice pieces to make it official. And so we were like, we really need to look at our outcomes the way we haven't really been looking at before. And as with what we do in public health, we want to know what our community needs are. We know what our community needs are, but we need like the data to show other people. So that was our goal. So we created, let me go back. We created these forms. I mean, honestly, it was like me and another state nurse consultant saying, let's get all the basic data collection that we have, right? That we're used to, and all the questions about your income, all the demographic, income, race, all that kind of stuff. And then we're going to talk about safe sleep, and we're going to ask whether you have a PCP or a dentist, and we're going to talk about breastfeeding. We're going to do all of these basic, items that we talk about in home visiting. And we thought, great. So we created these and we sent it out to Multnomah County as a pilot. And the feedback that we got was this: the surveys are oppressive, linear thinking of a white supremacist society that identifies the client as the problem. And they said, all of this data, it's not going to show you what the social and racial inequities are. It's not going to say anything about the work that the client is trying to do and that the nurse is trying to do. It's not going to really explain why things aren't working. Like, what are the systemic issues that are making this difficult for the client and the nurse? So what we did is we paused, we put a stop on everything. And we decided to go back to the drawing board and create whole new data collection forms with the help of a work group. And so we formed a work group with this vision that we were going to have really robust anti-racist data collection surveys, that we are going to have more complete data that is meaningful, that can tell the story of home visiting and the work that the nurses do, that's more strength-based, and deeply considers the social determinants of health equity. So that's what we did. And we created kind of a scope of work. So in scope was really looking at all of the questions in detail, adding, deleting, modifying, trying to change it to meet our needs. We weren't going to look at, are the goals of the program something we need to look at and change? We weren't going to, or kind of standards of obtaining the information. And I'll talk a little bit more about that later, but those were considered kind of out of scope of this work group. So the work group had several staff from various organizations that participated. So there was a group of people from OHA. We had nurse home visitors. So from Multnomah Healthy Birth Initiative, which is a culturally specific, African American specific home visiting program that does babies first. We had Washington County, Deschutes County, Lynn County. These are all kind of different counties in Oregon that have different just attributes. We had a program coordinator from a county that's close. Both Washington and Clackamas are closer to the Portland area, and along with Multnomah, but Deschutes and Lynn are more rural. We had program design and evaluation services representative, Native American Youth Association, the Latino Community Organization, and the Black Nurses Association representative, who also happened to be a home visiting client. So one of the things that we were doing this work group, and I attended the We All Count, the data equity class, kind of slightly before, but in tandem. And then we had a couple of meetings with the work group. And then I was like, oh, wait, we need to go back and we need to use this data equity framework. This will really help us. So that's what we did. And we moved through all the different pieces of the framework that I found to be very helpful. So the first one was the funding web. And so we created this funding web. And actually, I was just looking at these slides today and I thought, oh, you know what? Maybe would have been cool is what would happen? What would this look like if you moved the circles around, right? What, like, would it be easier to see how the money flows? Because right now, what I see is that there's more data flowing than there is money. And it's kind of hard to see like the actual influence. There is a lot of influence, and I do think that but the clients influence as nurses, and also how the community responds to requests for putting funding into home visiting services. And so anyways, I had a thought about that today, and maybe it'll be fun to go back later and kind of turn this around and see what does the web look like when you reorganize it slightly. But we did this so that we could just kind of start with the basis of understanding. And then we really looked at that motivation. What is the goal of the program? And we actually spent quite a bit of time on this. And it was really interesting because this was, so the Baby's First program, let me see if I can hide my floating meeting controls. There you go. The Baby's First program is a public health nurse home visiting program, and the goals are to promote health and well-being during pregnancy, infancy, and early childhood among at-risk families. So I thought this was a pretty, it's very basic. It's a goal that hasn't changed in 10 years. I mean, the program's over 40 years old and it has changed over time, but this has been the goal for a while. And what I discovered was that when you think about it from an equity standpoint, It's very broad and unclear, and there's some problematic language in here. So the work group changed it to be, this is a long-term relationship-based public health nurse home visiting program. And the goals are to reduce the gap in health and racial inequity related to pregnancy health outcomes, child growth and development, and injury among populations that have been marginalized due to intersectionality of systemic racism, classism, sexism, and social and other medical factors. And that was a key part, was that what are we really trying to do? We're trying to reduce the gap in health. We want people to have good outcomes. We want everybody to have good outcomes, but the problem is there's a gap in good outcomes. That's what we're trying to fix. And then the at-risk families is a problem, the problematic language. So they really wanted to be more clear about what we were talking about. We mean populations that have been marginalized. And there was a lot of discussion around that word as well and what to use. But this is what we ended up with at that time. So we then looked at, I really like this microscope idea. I found it very helpful, and helpful as a way to help other people understand what we're talking about when we talk about data equity, because it's a phrase and you can throw it out there and say it, but what does it actually mean? And so we looked at it from, okay, if you're looking at from OHA's perspective and you're getting data from clients and nurses, we want to, how well is this program working? Like, what is our program? Should we people invest in this program? Do clients get jobs? Do clients stop smoking? Do they breastfeed? Do they improve their health behaviors, right? So there's all these, what is the client doing? And that's going to say whether or not our program is effective. So, but what if you changed it to the client's perspective? And then your motivation is still, we want the program to work well, but your questions are different, right? Is the county and the state providing me support in the way that I can use it? Do I feel helped and supported when I participate in Babies First and Cocoon? Are these programs helpful? So this was a way to help us kind of shift our focus a little bit, even if the questions are not, some probably, we would need to do this as more of a qualitative evaluation, or this is an evaluation of the program by the client, maybe when they're finished, and there's all kinds of things that go into that, not necessarily the data collection as you're doing it. But I think that if you keep this perspective in mind while you're writing the data collection questions that you want to look at outcomes and program quality, that it's really helpful. So that's what we did. And then we worked on the project design and to try to kind of help guide our survey questions. And we kind of, in home visiting, we do at nurse home visiting, we do nursing assessments, and then our interventions are usually education, motivational interviewing, or behavior change and case management. Those are kind of the main ones. And that's where we focused on for our evaluation question, with keeping in mind this important question that it was like one of the things that really stuck in my head when I took Heather's class, which is who are you asking to change? What is the most equitable piece to adjust in this program? So that's also keeping that question in mind. So we, in the work group, we had lots of discussions about all the questions, and there were some themes that emerged. So we have to define at risk, and that's what you saw in the goal, and kind of reformulating the goal of the program is that's a throwaway phrase. It's hard because it does kind of encompass a lot of ideas and thoughts, but it's worth it to write down what exactly that is. Don't have any yes, no answers. Like that, yes, no answers do not promote any kind of system change. They don't really show the real work that people are doing. So, and you'll see an example of what that might be in a minute, but you really have to explain and describe and carry through about how you use these data to help the client. They said our clients are willing to give data, but the problem is they give, and they don't feel like they get anything back. And so that's a really important piece. Elevate racial equity, call it out, ask about racism as a social determinant of health. That's important. People have experiences, and you can't just pretend it doesn't happen. So the other piece that we're still really working on how to do this, but training home visitors to ensure cultural understanding and data collection. One of the things that the work group was really concerned about was it's not necessarily like that all of these questions are bad or wrong, and like we want to know this information, but how are we to be assured that when the nurses or the home visitors, whether it's a nurse or community health worker, goes into the home, that they're collecting the information in a culturally sensitive way. um, the other piece, always have a decline to answer. So that was something that we hadn't put in, and just having that as an option is important. Questions should be relevant and useful. I think we all agree on that. And the hard part is what we each consider relevant and useful and for what. And then the last piece, ensure data reporting. And we are working on this, but that has got to be you can't have the data collection without the data reporting. So those were our main themes. And essentially what we ended up with is 6 surveys that are specific to kind of a stage of development, age appropriate. We ensured that we had multiple reasons for no. So that goes back to the no, yes, no questions. We had in-depth choices. Um, at every visit, we have an every visit form that's only 8 questions. So it's really not a lot. And then, but our in-depth questions happen at key developmental milestones, and those um, have they are fairly that they're 40 questions somewhere around there. We ask about social determinants of health, access to care. We have some health outcomes. We talk a little bit, ask some questions about what the home visitor is doing. So these are kind of what we ended up with overall. One of the things that we did for the work group was that we hired a consultant, and we brought in 3 different consultants, and the work group interviewed them, and then the work group decided who they wanted to hire. So they hired the Coalition of Communities of Color. It's a local organization, and Multnomah County had done work with them in the past, so they were familiar with their work. And they had some key recommendations as well. I've already talked about it a little bit, but the first one was we have to kind of co-construct the assessment of the programs and the needs and support, so that we when we're doing our evaluation, whether it's our needs assessment or a qualitative evaluation of the program, that we need to involve other people, including clients, in how we do that. They wanted more training and mentorship for home visitors in data collection and essentially, I think just the cultural humility and sensitivity, but specifically in relation to data collection, because I'm not sure that we always talk about that specifically, and it's a little bit different. So they thought that it would be beneficial to have FAQs and talking points for the home visitors on some of the question. We ask pretty intimate questions. We ask about drug use and mental health and reproductive health and all of those things that can be sensitive topics. So to have really support for the people collecting the data. And then we needed to demonstrate action. So that goes with the last one about evaluation, engagement, feedback, action, right? Like, again, you can't just collect, 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 collect with no give back of what you're collecting. And we do have some work to do on that, and I can talk about that a little bit later. So we built in some action plans. We wanted to build awareness. We've done this similar presentations to this to like we have a nonprofit. It's a coalition of the local health authorities in Oregon. It's called CLO. The administrators and go there. So we did a presentation there. We have we use Basecamp to connect and communicate with. We have 34 different counties, and so we use that. So we put it on Basecamp. We had webinars about it. I have monthly conversations with all the nurse supervisors of the programs, and so we talked about the work that the data equity work group was doing there. So we were really trying to build awareness and provide transparency, which was what we were tasked to do. Honestly, still working on this training idea, because I was trying to combine people who train on equity and anti-racism with a focus on data collection methods. And I was having trouble finding somebody who really like specializes in that. So if anybody does, please email me. um, and then we were working on this evaluation. So we did the survey. So Theo is just the name of the data collection platform. We rolled them out. We have a feedback process where we're kind of revamping the surveys this year. We do have an evaluation plan, and we were able to have an intern come in and do part of it, but that was really focused on, it was a qualitative evaluation focused on the staff, the supervisors, and the home visitors. And so we have yet to have the resources to really do an evaluation that includes clients, or the quantitative evaluation. The assessment and evaluation team is working on a way for us to be able to do that with the current platform that we have. And so they've been working hard to figure out how can we get all of the great data that we have, that we're collecting out. So that's kind of what they're currently working on. I wanted to give, so when I did this presentation at the conference, it was a little bit more interactive. We had people go into breakout groups and say, like, what are the things that speak to you about how to make a question anti-racist? Like, what does that mean? And we focused on the idea of safe sleep. So a lot of these questions, like I said, like, the home visitors were saying, this is important questions, important topics. We don't want to not ask about it, but we just have to do it in a better way. Safe sleep was one that we ended up, having the result. We had their questions. Nobody was super happy with it. Actually, it's not an easy thing, and people were still like, okay, I think this is what we've decided. We decided to go ahead and keep in the question. So questions 8, 9, and 10, right? These are like the HRSA questions, like the safe sleep questions, that if you are a home visiting program, and you are a part of the maternal infant health home visiting system, and you're in an evidence-based program, if you want to talk about safe sleep, these are the questions that you ask. And so we decided to keep them in here, even though people find this very problematic. And safe sleep is one of those that's a very sensitive topic. So we kept these in, but we added one more question, which was number 11. And this is the strength-based question. And the question that, always, sometimes, never is kind of like a yes, no, like there's really no, that's it, right? That's all your choices. And there's no reasoning behind it. There's no context, right? Why is this? And there's still, we didn't really have a lot of questions that asked about context. We found that that was going to be really difficult, but we at least wanted to have the strength based question, which is how, if they co-sleep, because a lot of people do, how do they do so as safely as possible? And we have, and we have these multiple answers. So this is just a small example of a topic, and a difficult topic, and one where we needed to keep uh, some of the questions that people were unhappy with, but if we want to do any kind, it's the language that's out there of how we talk about safe sleep. And if you wanted to compare across any programs or be included with, you know anything about safe sleep, you have to ask those questions. um, so that is, let's see, that's what we did. That's what we did. That's our story. That's our story, and I'm sticking to it. And here, I think I have my wrong. That's not my email address. It's missing my middle initial. I'm gonna have to. I'm gonna have to update that. I'm sorry.
And no worries.
Okay, let
Thank you
me.
so much, Julie.
Yes, I'm
I
gonna stop
really am so
sharing.
grateful for the amount of nitty-gritty kind of walking people through. First of all, the fact that when you got that feedback, you didn't do what is so tempting to do, which is, kind of throw up our hands and be like, we don't have time or money. I felt so much joy when you said, so we paused. And I was like, if enough people simply understood the power of that,
Mhm.
of like, we paused, I thought I was like, thank you. And then taking us through the steps that you use and are currently using to r- rethink and reevaluate, what are we doing here? Who are we doing it for and why?
Mhm.
Without thinking, oh, this means we just can't do it at all or that we
Yeah.
can't do good science. I mean, I loved seeing the nitty gritty of your process. And I know that it takes a certain level of bravery to be willing to come and say, these are the pros and cons. We considered the pros and cons, and these are the choices we're making right now. We're still considering the pros and cons. We're
Mhm.
still getting the feedback and without trying to be like it's perfect now. And because of course
It's
nobody
not.
here
It's
is
no,
working
if
on
you
it.
saw all the feedback that we got when we rolled those out, you're like,
Right.
it's not perfect. Yeah. And yeah. Yeah. No.
So I really, really appreciate it.
Yeah.
And I want to give folks in the room a chance. I have a few questions that people have direct messaged me. There's a few questions in the chat. And I really also want to give people an opportunity to turn their mics on and ask questions. So if you're in the room right now with us live and you'd like to turn your mic on and ask a question, can you please raise your hand? You can either raise your hand using the little Zoom emoji. There's like a little person, like a little circle with a plus on its head where you can raise your hand, or you can just put it in the chat. But before we do that, can I ask you to share your slides just one more time? Because
Oh,
there was
sure.
a
Mhm.
lot of people that wanted to make sure that they understood those questions. Where you were saying the word the client in those questions. Is the client the child?
Yeah. Mhm.
Okay. Okay,
So
great.
we call, so yeah, so we call people clients. That's true. And
Sure.
there are people who don't like that word. There's lots of discussions about words.
Of
That's very
course.
important. Language is important. And however, yes, and we have caregivers. So our program allows, I'm sorry, I didn't say this before. So the Baby's First program enrolls pregnancy through a child age 5, and can enroll the caregiver, the pregnant person, postpartum caregiver. So caregivers can include grandparents, foster parents, all whoever cares for the child,
Mhm.
um, and the child. And so that usually they're enrolled together. And then we have, so the the six different surveys I was talking about, we have an infant and child survey. And
Yep,
so it's clear on the survey when you look at the whole survey who the client is referring to, because we have a caregiver one and we have
sure.
an infant and child one, and then we have a youth one for the cocoon program, which we also uh, the cocoon is for children and youth with special health needs,
Mhm.
and that's the other program, and they see people up to age 21. So
That's very
yeah.
cool. While you're sharing this, and we got a number of questions in the chat about the strength-based question. A lot of real excitement about this. A couple people saying that they're really interested in adopting this. Uh, and for people who are kind of new to the word strength-based question or new to the idea, can you share a little bit about what you or your working group was trying to capture, what you mean by strength-based question and how you came up with this one?
Sure. That's a great question. And I'm smiling a little bit because it's also one of those terms that, like, in my world, we just talk about all the time. And I've never really taken the time to like, what does that actually mean? So I'm
Yeah.
going to kind of do it on the fly here. But so everybody has strengths, right? And when you go into a home and all you see is deficits, it is not hopeful and it's not helpful. And you really need somebody's strength to be able to build on that if you want to see any progress in the areas that they want to progress in. And so the strength based is okay. So in relation to this question, for instance, if they are never, if they always co-sleep and they never have a baby in a crib with no bumpers and no blankets and no stuffies, um, if that was the only story and that's what you looked at, it would be that's deficit. They are not doing the right thing. They know what is safe and unsafe, and they're choosing not to do it, and that's bad, right? And there's all these things. So, but what you turn that around and say, well, what first when a nurse goes in, they would say, what is the story behind that? Tell me about what your thoughts and feelings are, and kind of um why, what does this do for you, what's the situation, right? And then the strength is these items back here is those are pieces that you can build on. We know you love your baby and want your baby to be safe. And I see that even though you're sleeping with your baby in the bed, which as a nurse I can't recommend, I do see that you know that you're not going to drink alcohol or smoke in bed because that increases the risk, and you're making you're choosing not to do that, so that's a strength. And so we always go in with what are the pieces. You can find strengths really in anything. Even if you go into a home and you feel like, oh my gosh, these people, their life is falling apart, they have all these issues. Well, they let you in their home and they agreed to sign up for a program because they want some help and they want to do better. That's a strength, right? So let's start from those areas. That's kind of the idea. I don't know if that
Yeah.
explained it very well, but
I think that did a great job of explaining your thoughts on strength-based, and, I really appreciate you, as you say, again, being so transparent to be like, "I don't have a written out, description." We use that word a lot, and I know you well enough to know that, like, you now have a note and you're gonna go back
yeah.
and you're willing to kind of go with it in the moment. Another example to kind of answer this question, that's it's in a totally different sector, but I know that there's a lot of people here who are wondering about this word strength-based. We also use it sometimes in educational research.
Mhm.
So, we a strength-based approach is to say, assume that students are engaged in healthy behaviors and are healthy humans, that are making choices that are right and good for them.
Mhm.
And so, rather than saying, how can we change the student's behavior and get this student to not drop out of this school? let's assume that if this student is dropping out of this school, that's a healthy, strong behavior that they're making because the school is not a healthy place for them to be. So instead of fixing the problem behavior of the kid, how can we fix the environment so
Yes.
this inherently healthy kid will want to stay in this environment? So that, I mean, we could talk
That's a
for
great
days,
example. Yes, absolutely.
and
Yeah.
it's not very simple. And there's a couple of people saying, there are really have to think really carefully about what is the purpose, what are we trying to understand. And I'm
Mhm.
not saying that the example that I used is the approach you should always take. It's just important to consider your options. And so that's a really, really important question that is present throughout any data project. And I wanted to circle back to, because I often use the terms, where do you want to put the onus to change? And I've been looking for a better phrase for that for a long time. And I think that you gave me one today, which is, what is the most equitable piece to adjust? I really, really like that rephrasing because it's much more concrete, makes a lot more sense to me. So, what's the most equitable piece to adjust? Are we actually trying to change somebody's behavior, or are we actually trying to change the environment that somebody's living in?
Yep,
And oftentimes we say it's the latter, but we collect data in a way that makes it very clear that it's actually the former. And so
exactly.
that's what we're looking for, is like, how can we get that congruence towards what we want? A couple other questions in the chat. And if you want to turn your mic on, go ahead and raise your hand, or just message me. There's a lot of people that want to know how you got folks to participate in the work group, specifically people who maybe were clients of the Baby First program, people who were really busy.
Mhm.
Um,
Yeah.
how did you manage that?
Well, the main participants were from Multnomah County Health Department who just are super passionate about this work. I mean, they do so much extra work outside of home visiting for systems. Like if you remember, I said the Healthy Birth Initiative is a culturally specific program. They only enroll African American clients. All of the nurses are African American. They this is near and dear to their heart. They step up and they come. And then I just put up a call out on Basecamp. I said we, use that, and the other people who came were also um, people who do this work, right? It's like it's always the people who this is important to that come. And honestly, and then I specifically wanted other organizations. So I just was like, where are organizations in Oregon? And I just like, I think I reached out to maybe six, um, and three got back to me, and then the Black Nurses Association, or their association of the Alliance of Black Nurses Association is what they're called, and they had somebody, the person just knew, and she was in nursing school and she had been a client, so that was just kind of luck. That was luck. um and I wasn't able to get any more clients. We're working on, so one of the outcomes that I didn't think that I mentioned is we now have an advisory group to Babies First and Cocoon. And we have 3 clients on that, and that was just, we reach out to the home visitors and say, do you have a client who you think would be willing and able to do this? And then they reach out. So that's kind of how we do it. We do pay them. Um, uh, um, so yeah, but for this group, and I just saw something pop up in the chat about a science satisfaction survey. And do you mean of the clients who participate in the program or of the people who participated in the work group? Participate, Michelle, do you, no, the answer is no. Regardless of regardless of which group you're talking about, I didn't do satisfaction of the work group. And we have talked about, yeah, so we've talked about having a satisfaction survey for the clients. And to be really honest, I was like, let's get the data We have some work to do with our reporting and our ability to kind of analyze data and report it out. And I want to get that settled before we start trying to collect survey data on clients. And then if we can't get that out as well, right? We need to kind of get that in order. But yes, that's definitely a goal. We'd love to have that be a part of the program. Mhm. Yeah.
Yeah, it's a great answer. Um, I wanted to amplify one of the other questions that was in the earlier part of what you were talking about. And I'm going to read the question so I get it right. I really liked your slide on the scope limitations. Was this hard to actually maintain in the setting of a working group when, so I think the question is, were people, you had in your slides, the scope is to change the way we're collecting data. I'm not going to get this exactly right, but the scope
Oh,
was not to change like the purpose of the project or the
right,
logic model of the project, because of
right.
course there's all kinds of equity issues in every part of a project, and it can be
Yes.
extremely hard to pick one area of focus
Mm.
and stay there.
Yeah.
And so the question was, were you successful in that?
Yeah. Yes, we were. Yeah. Like, the only time, so when we were working on the goal and like restating the goal, that would be the only time where it kind of crept in, because people, so we ended up with, we're going to close the gap, and people did say, is that really what we do in Babies First? Like, it is our program designed to do this goal that we're saying?
Right.
And we do have a logic model for Babies First that we came up with. I do think that goal fits in the logic model.
Hmm.
Um, but it was also scary to some of the people who do the work, the home visitors and the supervisors, being like, this feels like a big, when we're talking about the system, and we're going to close that gap in health, because like, yes, we do that. And when you start to write it out that way, very detailed, and you
Right.
call it out that that's what you're trying to do, um it can be scary for people. So we had a little bit of that kind of in that part, but otherwise, I mean, we just had so many questions to get through and so much to talk about,
Right.
every question, that I think people just were able to focus on that. Yeah.
Well, congratulations. That's not easily done. And I have had a lot of the same experiences that you've had. Is one of the reasons that those scoping statements or those project purpose statements are so vague and are so broad, is that it provides a lot of emotional cover, and it makes it very hard to hold anybody accountable. And when you start asking people to get much more specific about what we're actually trying to do, what we mean by these vague kind of social identity words, um, and where what's the most equitable piece to change.
Mhm.
People get very, very anxious and nervous. And the fact that you were able to kind of hold focus and keep them on track to get to that second example of a project scope that you showed us was super impressive. I really got to hand it to you. That was really, really well done. And a couple of people are saying, how did you justify the time and the money?
Well, equity is, at the time we had a director who had actually come from Multnomah County and knew about the HBA program, and had just, as a whole, for the public health department, um, equity is like number one. We have like a whole nother, it's not a section, but it's like a team in the director's office that is specifically about kind of community outreach. We have like a statewide goal to reduce, or like get rid of all health inequities by 2030, something like that, right? Like, so it wasn't hard. I said, this is the feedback that I got. We can't not respond to this. And everybody said, yeah, you're right.
Yeah.
So
Great. Well, that's also a huge relief and not the normal situation that at least I run into on a daily basis. So
yeah.
again, something is really going right in your part of the world. And I think for our last question, I'm going to go to something much more general and zoom out a little bit and say, with what you've experienced with getting the feedback, getting the resources and funding to take that pause that a lot of people in the chat have resonated with, like how important that pause actually is to making change. Making change can feel like something you need to do urgently and very fast, but without the pause, the making change often makes things worse.
Mhm.
Um, and you've seemed to have had a lot of success in actually getting things to change. For people who are working in sectors similar to yours in the United States and in Canada, do you have a suggestion of what the first step that you would recommend a person in your shoes take after the pause? We all know the pause. We've agreed on that today. What would be the very next thing if somebody kind of just needs that concrete next step? What would you suggest?
Well, gosh, I mean, I feel like my brain immediately went to, I need help. I cannot do this alone. I'm not gonna sit in my cubicle and then recreate this. Like my so that's I mean, my immediate next step was we have to get a work group together. So you have to bring in people um who want to work on this and who want to partner on what data equity looks like.
Right.
And so, start building that coalition really of people who that's important to them, because then they'll make the time and they'll come and um and that's really, I think, the step is that you've got to get, it can't just be you,
Right.
right? You've got to get more people, and so you got to start looking for who are the people that care about this and will come to the table, I think.
Great. That's a great concrete step. And it is absolutely one of the reasons that we have this very format, like talking data equity. Part of the reason is exactly that sometimes when people need that group of people to talk things over with and explore new options with, and they can't find the people immediately in their own projects, or they don't have the support from senior leadership in terms of time and money. So that's the idea behind talking data equity. So I think we will leave it there to make sure everybody has time. And Julie, it has meant a lot, both to me and, as you can see, to everybody here at Talking Data Equity, that you were willing to come and share as specifically and in as much detail and transparency as you did. I really appreciate that. Um,
Absolutely, my
and
pleasure.
the recording of this will be in the data equity community forum. I put the link in the chat. If you have somebody, if you that you want to show this to, if you want, I mean, things like this, sometimes people come to me and say, how can I convince my senior management to give me the time and money? Show them the
Mhm.
video. It'll help. There are other ways, but one of them is this. And programming note, next Friday, we are not here. So there is no talking data equity next Friday because I'm not here and available. There is talking data equity in 2 weeks, and it is one that you should not miss. It is Dr. Joy Washington. And I don't know if you know Joy, but if you don't, Joy is working in the public health sector and has a set of amazing ideas about equity on a personal level, on a structural level, what health equity means. And she's running all kinds of different podcasts and learn how to write research schools. And she's a really fantastic person. So um, next week, do not come. We are not having Talking Data Equity next week. 2 weeks, come. It's Dr. Joy Washington. And the last thing I'll say is a huge thank you again to Julie. Your time is so valuable, and we've really, really benefited from your generosity, from everybody else
Oh,
who's here. Thank you for coming, and welcome if it's your first time. Come back.
thanks, everybody. Appreciate it. See you.
Bye, everybody.